The date today is November 6th, 2024, and this is the first in series of appointment. I have a 27 female that presents for an initial assessment, and the patient ID number is 12345. Patient reports with no chief concern, and the patient is here today for nutritional counseling. And thank you for taking part in the 5-day diary and hanging out with me today.
Yeah.
Okay, so taking a look at your medical history, your vitals are normal and your blood pressure is also normal. It's 120/80, and pulse is normal, which is 68 beats per minute. At your conditions, you listed high cholesterol, medications none, allergies none. Dental history, ortho in 2008 and got them for 4 years, and third molars removed in 2019. Dental habits, drink water only and pop at mealtime, which you only drink half a can, but your diet is high in carbs and sodium. And your personal oral hygiene is that you brush one time a day only, and usually in the morning. Fluoride mouth rinse every morning with that, and you use Sensodyne toothpaste, a manual soft bristle toothbrush, tongue scraper, and floss picks 2-3 times a day, and you use floss string one time a week. Alright, so earlier today we did your extraoral and intraoral findings. Your intraoral findings, which was feeling around the inside of your lips and looking for any lumps and bumps. And for your lips, I noticed that they were dry, and you also have angular chelosis. And this could also be a nutrition deficiency in folic, iron, riboflavin, vitamin B6, and B12. As I was looking at your food diary, I see that you have sufficient amount of vitamin B6 and B12 and riboflavin from eating salmon, eggs, and milk. And you also have a good amount of iron in your food, like eating chicken, turkey, and beef. However, I don't see enough folate foods like leafy greens and beans or citrus fruits, and that could be a cause of your dry lips. And so we did a PI score, and PI stands for plaque index, where you use each one the pink tablet, and it showed how much biofilm you had in your mouth, and it was about 45% based on my calculation. And plaque is just a biofilm layer that sits on your teeth, and it's made of bacteria that can cause cavities. However, for now, I did place you at a low cavity risk just because you do a great job with eating gum after every meal. So I noticed that you have mental gum, and it's after breakfast, after dinner, usually a piece of gum after every meal that you have. And how long do you eat your gum for after each meal?
About 5 minutes.
5 minutes?
Mm-hmm.
Okay, so our recommendation, or if you look at the package of the gums, usually it's about 20 minutes that they recommend you to chew, so that you get more saliva production flowing through your mouth. It seems like throughout the day you drink plenty of water, and that is really good because you are essentially flushing away the bacteria in your mouth. Based on your food diary, I also noticed that you have a preference for cultural foods such as white rice and bread. These food are high in carbs, and they can contribute to tooth decay because they contain sugar and starch. So you look at the food items on here, the things that I circled in red are food that have sugar in it,
Okay.
like hidden sugars. So your milk, your sourdough, croissant.
Wow.
And also fruit. So food that are high in carbs, they contribute to tooth decay because they contain sugar and starch. However, consuming fermentable carbs as part of a balanced diet, along with good oral hygiene practices like brushing, flossing, and rinsing after each meal can reduce the risk of cavity. So that also means that the more frequent you eat or snack on food, the higher risk you are at for getting cavities.
Okay.
And earlier I mentioned that drinking water and producing saliva is good for your teeth because it brings in minerals. It's also because it acts as a buffering agent. It's also important to consider factors like frequency in snacking, drinking because you're at a higher risk of cavity, and having good diet, understanding the bacterial plaque like sugar because they produce acid that damages our teeth when there's no saliva to flush it away. And going back to your condition that you listed, high cholesterol, a lot of the food that you eat are also very high, and I noticed that you have eggs in your meal, like for breakfast and dinner. Egg is also really high in cholesterol, so it'll be good to kind of limit on eggs as well. You're doing a great job at eating your Mentos gum and choosing the one that is sugar-free and has xylitol in it, and it seems like you're also flossing after every meal. But one thing that I do want you to do is to also brush at night, because as the day goes by and you're eating food, plaque builds up and the bacteria just sitting in your teeth. Therefore, it's important to have clean teeth before you go to sleep so that the bacteria doesn't stay on your tooth surfaces.
Okay.
And talking about staging and grading, you are at stage 1, grade A for period disease. To break this down, you just have early bone loss, and this is also it can also be contributed by fermentable carbs, and when they are stuck in your teeth and you're not cleaning it often, it can produce toxin, and each time you brush and floss and it bleeds, it's because of the bacteria. At a stage 1 due to having 10% bone loss and also having 4mm pockets. You are at a grade A because there is direct evidence of no bone loss progression in the last 5 years.
Okay.
So I know that I talked about a lot of things today, and I was wondering, do you have any questions for me, or would like me to go over the subject or topic again?
No, I'm good.
All right, thank you for coming in today.
Thank you.